Good afternoon, everyone. My name's Amara Fonseca, and I'm the Acting Deputy Chief Radiation Therapist at Northern New South Wales Cancer Institute. And I'm going to talk today about an initiative to introduce Delta therapy dog visits for patients and their carers and families attending radiation therapy treatment at the Northern New South Wales Cancer Institute. So the aim of this project was that within 6 months of the Delta Dog Visit program commencing, 50% of the patients participating will have benefited from the visit and they'd support program continuation. And we were going to measure that from voluntary anonymous survey data. The members of the project team there. Now, before I go too much further, I'll just explain a little bit about what Delta therapy dogs are and how the program works. The staff surveys that we use to gauge staff support and opinions of the program showed that not very many people at all had any previous experience of therapy dogs, and this may be the same for the audience. So every team consisted of a volunteer and their beloved pet dog. Each Delta accredited dog has undergone strict temperament testing. They've had vet checks, and they obviously have to go through some pretty stringent procedures before they're allowed in to visit care facilities. Equally, the human volunteers have a police check, and they do a training seminar, and that covers topics like occupational health and safety, facility procedures, communication, human health, all of that kind of stuff to get them sort of ready to visit facilities with their dogs. So once they're ready to go, the volunteers and their dogs are then available to visit and talk with patients and families, and they're there just as a presence. They can offer a hug, a paw to shake, and maybe a furry ear to listen. So the use of therapy dogs in cancer care is actually really well supported by evidence, and the potential benefits to patients can be improved self-esteem and well-being, a positive effect on mood, increased social interaction, and improved pain management. Now I've said all that, I'll tell you why we might do it in our setting. So Northern New South Wales Cancer Institute is located in Lismore, so we're a regional setting, and our patients are often required to be away from home in their support networks. We service all the way out to Tenterfield, so that's probably a 2-hour drive, and it's impractical for patients, obviously, to be making that round trip daily. So they might stay in the Lismore area for the duration of their treatment and just going home on weekends. Now, we looked at the last 6 months of mosaic assessment data at the psychosocial assessments, and we found that 23% of our patients lived alone, 10% of them didn't have any emotional support, 16% are away from home for their treatment, so away from those usual social supports, and 30% of our patients had moderate or higher distress levels. Therapy dogs can act as social catalysts, easing interactions, and they can reduce the feelings of isolation. And contact with the dog and volunteer team can also reduce loneliness and give comfort, encouragement, and satisfaction to people that are away from their usual networks. Now, Delta dog therapy is actually considered a complementary and alternative therapy because it enables patients to be active participants in making decisions about their healthcare. They can decide if they want to have a visit or not. They can decide what their participation level in the visit is. So for this reason, it actually aligns with the National Safety and Quality Health Service Standard 2, and that's the one that relates to partnering with consumers. Okay, so when we started this program, we went through some very specific project methodology, and we developed a driver diagram. The problem obviously was psychosocial distress, and there are various drivers for that. The things that I've already mentioned, being away from support networks, obviously the distress that's related with the diagnosis, might be financial distress, and there might be problems within the family and difficulty relating. So there were a number of solutions to these problems. Some of them are already implemented, and those are the ones in white. The solutions highlighted in red were a bit difficult to implement and impractical, and those were things like additional radiotherapy centres to reduce patient travel. And the green solutions were priority solutions due to perceived ease of implementation. So our priority solution was obviously the Delta Dog program, and that was to implement a weekly visit for patients and families or carers that wanted to participate. Now, as part of the project implementation methodology, we ran PDSA cycles for several key components of the project, and that included several iterations of the project brief and supporting policy and procedure documentation. That was also the case for the quality improvement application to our ethics committee. So after we produced the project brief and supporting documentation, we set about devising a comprehensive set of outcome measures, and those were designed around service delivery and patient and staff satisfaction. We developed a comprehensive evaluation and monitoring plan, mostly utilising the data provided by electronic reporting in Mosaic, but also patient and staff surveys. The key endpoints that we designed after 6 months of program delivery was no increase in patient waiting times, and when I say waiting times, I mean the time that the patient's actually waiting in the clinic to have their radiotherapy treatment, not the time it takes to get them in and get them started. We obviously didn't want to see any incidents as a result of the program, and obviously bringing dogs into a cancer care centre, that's, we do have quite large perceived risks of things like infection. People are concerned about, dog bites or people being allergic to or afraid of dogs. So that was really important to us that we didn't see any incidents. And 100% compliance with the procedures developed for program delivery. And again, that was all about the perceived risks. We didn't want to see any increase in the staff workload other than the staff member responsible for accompanying the volunteer team. And obviously, because this is about patients, we want good patient participation levels and high levels of satisfaction with the program. So, results. We're now 3 months in, and I'm really, really happy to say that the program's been well received by patients and staff. Feedback's been extremely positive. It's still really early days, but we haven't seen any increase in workload. Waiting times haven't increased at all, which is really pleasing. People aren't seeing it as a distraction or a disruption, and thankfully we've had no incidents of any kind. Although we will be assessing some quantitative measures as part of the program evaluation, a program like this is really very much about patient and staff experience. And for this reason, I'm mostly going to be showing you qualitative results, so patient feedback today. We did do a pre-implementation staff survey, as I mentioned earlier, and this was mostly to gauge initial opinion and identify if there was strong resistance to the project that might be able to be resolved with targeted education. I'm not sure exactly how well you can see that, but I can tell you that the results were really, really positive. Staff didn't seem particularly concerned that the workload would be negatively affected, and most actually felt that the dog visits would improve the work environment, possibly even improve interactions between staff and interactions between staff and patients. Equally, most staff weren't concerned with the potential infection risk. This might have been influenced by the huge amount of communication and strategies that were developed regarding the infection control policy and what we were going to do, and having a really good risk management strategy. But it's possible it was also influenced by staff's general attitude towards dogs. So we are collecting ongoing patient, family and carer surveys post-visits. These are completely voluntary, they're completely anonymous, and patients that want to provide feedback can do so. So all patients would be given the option if they want to provide some feedback. Now, bearing in mind there's a really strong selection bias with these results. They were overwhelmingly positive, and all respondents wanted to see the visits continue, but obviously these are the people that have participated in the visit, so they want to have the visit and they already think that it's a good thing. But having said that, we do collect general patient surveys. These are available for all patients to fill out in the waiting room, and we've not received any negative feedback through those, so that's really pleasing. Okay, so I'm just going to leave this one up just for a couple of minutes and let you read the comments. It's really beautiful to see those comments, and I think it really shows what people are experiencing through that dog visit. Now, in terms of patient experience, the picture and the comment next to it really says it all for me. There's just so much joy in that picture that's wonderful to see. And I should also note that while the comments actually focus mostly on the dog, what I've observed is that it's not just the dog. The dog's there as a catalyst, but what happens during the visit is that the patient's talking to the dog's human partner. And also our social worker, Mel, is present at the visits as well. So it really gives the dogs there, I guess it's kind of almost like in the plenary when they were speaking about having a conversation sitting beside someone, it's almost like that sort of experience. And I think the comments don't really capture what patients are getting. It talks about the dog, but there are other benefits as well. So even though we're only 3 months in, it's really important to keep looking for improvements. Moving forward, I'd like to see this implemented at the other centres in our network, and within our own centre, I'd really like to look at strategies in terms of increasing participation rates so that we can provide the experience to more people. As I said, when we started, we had a really strong focus on risk management and making sure that we were safe and making sure that people didn't feel like they had to be around the dog if they didn't want to. So currently we have a very small contained area which limits how many people can access this service. And obviously it's something that I would like to look at in the future, is how to reach more people. And that's it. Before I finish up, I'd just like to thank Mel Gregory and Stephen Manley for your active and ongoing support for the project.
Thanks very much, Amara. Questions for Amara? Yes, we've got one over here.
Months for them to come.
Yeah, it was a really long time, and probably around about the 12-month period. We did spend a lot of that time working on the risk management strategies and getting infection control together and going through the quality improvement application. So we were using that as active time, but yes, it was quite a long way, and it's quite difficult because obviously there's a lot more demand for the dog teams than there is supply.
Thank you. One more question? No, okay. Thank you. Please thank Amara Fonseca. Thank you.